Welcome to the HIT podcast, H.I.T, Human Resources, Insurance, and Technology. I'm your host, Toby Kennedy. We ran a little long with our conversation with John Montague. We're talking about Surest. It is a fascinating conversation. Parts 1 and 2 aired last week and the week before. We're going into part 3. If you missed anything, go back to last week, go back to the week before, catch all this conversation. Today is part 3 of our fantastic, fascinating, awesome conversation. I've loved every second of this. Without any further ado, this week's episode is brought to you by Montage Insurance Solutions, and let's pick right up where we left off.
I want to pause on that because it's so profound. So what you're telling me is you guys have brought forth a plan that has no deductibles, no co-insurance, does not narrow the network of providers, is running 10 to 15% below for employers on the premium standpoint, and the member experience for the same episodes of claims is 50, half off, 50% reduction in what members had experienced when they would have gone through these same claims with deductibles, co-insurance, the normal plan designs. What the members are paying is half.
Exactly right. And all the points of the thesis when this company started have been proven to be true. That if you can reduce wasteful spending, that's where you should be focused. And when you look at the cost of healthcare, there's really 2 elements to the total cost of care, right? It's unit costs and utilization.
Right.
And in our industry, I think we spend way too much time focusing on unit costs. There's
so unit cost, let me back this up real quick. Unit cost meaning to get my knee surgery done, what is the expense for that, right? Unit cost. And then utilization meaning, and how many knee surgeries are we doing, right?
Yeah. Or look at it a little differently too. Look at it utilization. Where are you going for the care?
Right.
So a great example, we talk so much about network discounts. And, I think carriers are all talking about their network discounts, and, you can move the needle a couple points here or there with maybe better network discounts. But if all the members of a health plan are utilizing care at high waste, inefficient, ineffective providers, who cares what that network discount is?
Yeah.
Or if you're going into a certain place for care, maybe to deliver a baby, and maybe that hospital has a nice low contracted rate for their deliveries, and it looks good on paper, but when you go in, you get hit with an out-of-network anesthesiologist as part of that episode of care. Well, that's going to drive your total cost of care as a member through the moon.
Right. And it's not necessarily, like you said, going to show up when you're trying to spreadsheet one carrier's network versus another. You're talking about maternity, and I thought that was one of the most profound examples I saw when we looked at this plan, because normally when you say maternity, what you really mean is like all the 10 million things that go along with it. But you're saying, no, this entire thing. So one hospital, I think on the example is like, $895. One was like $2,500 or whatever. And you tell the pregnant mom, hey, listen, utilize this option or that option, but this entire episode of delivery and the baby and the hospitalization and everything, like you said, you're not going to get that bill from the anesthesiologist that was out of network. You're not going to get some surprise cost. You're going to see, if I have this baby here, it will cost me specifically X. If I have this baby here, it will cost me specifically Y, and that's it.
Exactly right. And, we look at care as the total episode of care. So for that example of labor and delivery, we're going to take every single cost and we're going to bundle it all into one copay or one price that our members see. So the doctors, the anesthesiologists, the facility, we joke, the janitors, who knows what, the imaging, all the different things that go into that entire episode of care. We're looking at that holistically. We're putting one copay on that entire episode of care. So what your total cost is going to be for delivering your baby before you walk through the door of that hospital. And then when you walk out the door with your baby in your arms and you go home, you're going to get one bill for one amount. And it's that exact amount that you knew going in. There's no surprises. You're not getting that surprise bill from the out-of-network anesthesiologist. And a really interesting fact I can share with you is less than 1% of our members are hitting their out-of-pocket max.
Right.
Think about that.
Yeah.
And so much of that is because of the transparency that we're providing and that we're eliminating. So often people are hitting their out-of-pocket max,
Right.
not because they had a cancer diagnosis, not because they had a horrific injury and they're a high claim scenario. They're often hitting their out-of-pocket max because of surprises, things that they weren't expecting, and things that are being egregiously billed,
Yeah.
that they couldn't avoid. And now they get home from an episode of care like delivering a baby, and all these bills just start showing up. And now they got to figure out, how much to pay, how many different pieces to the puzzle. And when that bill comes from the out-of-network anesthesiologist, again, it's a huge cost that gets incurred, and there's nothing they could do to avoid it. So to understand what we're doing, we're setting copays on all these different hospitals, giving the mom a clear cost of what it's going to be to deliver her baby up front, whether she has a C-section or not, whether she has an epidural, if she runs into complications, ends up getting hospitalized for 3 extra nights. That one copay is going to cover everything in that entire episode of care. No surprises. When we see a provider that has that out of network anesthesiologist showing up in the mix, or has these other surprise things that are driving up the total cost of care, well, that's when we're going to jack their copay way up.
Right.
So the copay can alert the member of that and help steer them to the hospitals that are providing the high value care without those hidden
Yeah,
costs.
and by the way, ideally at some point, start steering the providers. And like you said earlier, 80% of them, you're calling them high value. 90% of them, we're calling them moderate or high value. It's really just those 10% of providers who are engaging in practices that are, like you said, sort of needlessly jacking up the cost. And so when members don't see that or feel that, they go, well, I have a flat whatever, I don't know, whatever their plan is, $500 per admit on either hospital. I don't really know or care or ask these questions. If the copay schedule starts getting dynamic in this way, then you can start to help steer. And when I brought this up to my HR person here, she goes, Toby, thank God, because can I tell you, in the past when I've asked, well, who do you recommend or which doctor should I go to? Anyone that works on the carrier side, they have to act like every provider's amazing. I don't know. It would be unlawful for me to explain that some doctor is better or worse than any. And it's like, we know in any profession on earth, we know there's X amount of people that are going to be lower performer type folk. And so for you guys to say what we've established is a multi-billion claim point AI driven multi-source manner in which to sort of kind of power rank these doctors. And then all we're doing to members say, see whoever you want. You go to church with that guy, you play golf with that guy, go see him, no problemo. But we're going to shift the co-pays around a little bit so that for anyone that is on the fence or curious, or maybe, by the way, would rather get the colectomy from the doctor with a 5% infection rate on the back end instead of a 45% infection rate, that I think is some of the strength of this. We're sort of coming up against it time-wise, and I appreciate you so much for being here. I guess what I want to do kind of before we bring it home, are there important pieces to this that in today's episode we really want to make sure we hit on before we get out?
I think just how intuitive and easy it is. I think that, when we came into the market, we heard terms like disruptive and game changing, innovative. And I think it gave people the feeling that we were just blowing everything up, doing things so differently.
Yeah.
And I think, and you heard so much talk about behavior change. It's all about behavior change. And I would say, you know what? It really isn't about behavior change, because we've been behaving this way, like I said, when we buy groceries, when we buy a car, when we buy a house, when we buy other types of services. This is the way that we are used to behaving. I would say that we're not demanding behavior change. I would say what we're doing is we're finally enabling consumers to behave the way they always have and wanted to with healthcare. And I think that there's also a big misperception out there that people are disengaged from their healthcare and they're apathetic, and that they're not more engaged in their healthcare decisions because they don't care or they don't want to be. I would argue that vehemently and say people aren't engaged because they haven't had a health plan design that enables their
Or
engagement.
access to the information to be engaged. If everything is hidden from
Exactly.
them, how are they supposed to? What most people don't know is there is zero, ostensibly zero correlation between cost and quality in the healthcare game. Normally, when I buy a $20 cell phone or a $1,000 cell phone, you can expect the $1,000 cell phone has more computing capabilities and a better camera. It's a better product. In healthcare, that is not true. And I think that that's a good point to get out on, which is you guys aren't steering people away from the more expensive providers and to the cheaper providers. This isn't about steering them to cheaper providers. It's about looking
Correct.
at quality and outcomes and who's performing better, because there is no correlation in healthcare between cost and quality. So what we need to do is create a transparent system that shows people from a quality standpoint, not cost, from a quality standpoint, this might be the provider you'd want to go to. And we're going to dynamically flex the copays in order to steer you there. I'll get out by saying, you guys are Surest and you're awesome. And I was like, wait, that's like a name brand though. Is there like a generic term for this? Because surely every carrier is going to start copying. It's like we're out in the game before there's even, it's like once we stopped calling it an iPad, we sort of started calling it a tablet because everyone just kind of or like everyone Googles it. And it's like, well, now we put it in the search engine because we have to kind of back away from the brand. I'm like, I don't know, maybe variable copay plan or VCPs or dynamic copay plans. Like we have to come up with something that comes to the top of the column and goes HMO, PPO, VCP, right?
We prefer that it's just Surest.
That's it, baby. That's
Surest. And I tell people there is no sure thing in health insurance, but there is Surest.
That's right. That's
And
right.
that is us. And right now we like kind of being in that category
You're
on
one of
our
one.
own as the innovator, the pioneer.
Yeah.
But no doubt there's other products coming into the market that are going to try to achieve a lot of the same things. Ultimately it's just all about value-based care.
But the reason they might not
and
be able to is the
navigation.
access to data. I mean, you guys, like you said, you're a data science company first, and you're 7 years into this, and you guys are just basically showing the world, if you redesign it in the aforementioned ways, you can run 15% below and your members pay 50% less and your quality be better and there be no deductibles and there be no co-insurance.
Yeah. And I can tell you that everybody at the company that's been there either for the whole 7 years or just joined in the last couple of years, everybody at the company is very proud, and I think everybody has a real sense of doing good, purpose, passion, because when we provide our health plan to employers, we know that it's genuinely going to help the employees. And we look at these big clients we have like Target and Best Buy with all these thousands of employees that are out there working on the front lines every day, that are sometimes the lower, medium wage type employees. And we know how much this health plan is helping those people and their families.
Yeah.
And we also know how much it's helping the HR teams
Yeah.
that are now, instead of fielding complaints about their health plan, they're getting, comments from their employees about how much they love their health plan, and something that's just more simple, easy to administer. And then, obviously making the CFOs and the CEOs very happy as well by what it's doing for their balance sheets.
Yeah.
We all have a lot of pride, I think, and a lot of satisfaction that this is proving that truly it's not too good to be true.
Yeah.
The results speak for themselves over the past 7 years. And I think with our recent acquisition by United Healthcare 2 years ago, and now taking this incredibly innovative product and then supporting it with the vast resources of United Healthcare, I think kind of the best is yet to come. It's
Yeah.
just going to continue to get better. And it's going to continue to serve both our employers and our employee, the members,
I think
in a
you
better
have
way.
every reason to go to bed and to wake up proud of the work you're doing. We're trying to impact huge American healthcare spend. John, I can't thank you enough for your time today, and for your just professional career, man. I just really appreciate you, everything you've done, everything coming out today. Thank you.
Thank you, Toby. I appreciate what you're doing. You're shining light on what's new and exciting and different in an industry that, frankly, a lot of people would rather stay in the dark.
Yeah, well,
And
yeah,
I love
exactly. I
when
can
I
keep
come
this under
across
my hat
people
and
like
just show
you
it to
that,
my clients, but I want to get the word out because I really believe in it. And I agree with you. I think it's easy to only know what you know and sit in that space. But for those that do, care about learning, that's exactly what we're here to do today. That is all the time we have. Thank you to our sponsor, TrueHue. Thank you guys for watching. Join us next week. Join us every week. And until next week, make this the best week yet.